Hello, and thank you for joining us today. This is a presentation on managing COVID-19 in your RCFE or assisted living community. We have several presenters today, and the information is crucial to keeping your staff and your residents healthy and safe during this time. Throughout this presentation, there are multiple contact numbers and links that you can use for information and supplies to help you manage through this challenging time. This represents 1 hour of caregiver training. Please contact lookingforcare.com with any other questions. And again, thank you for joining us. My name is Deborah Graves. I'm the President and CEO of lookingforcare.com. I'm your hostess today. I have my team with me, Marianne Richardson, who is the VP of Client Engagement, and Kathy Inoselda, who is our COO. Kathy will be acting as our producer. Then I'd like to also introduce Misty Plumley. Misty is a paramedic with Riverside County EMS. She is with our clinical team, both Dr. Frank Flowers, who is with the Riverside University Health System, and Rod Coney, who is a physician's assistant with Vituity Medical Group. There are a couple of good things that have come out of COVID-19, and the first thing is this wonderful association with Dr. Flowers and his team. I'd also like to acknowledge another thing that's wonderful that's come out of COVID-19, and that is our reliance on telehealth. I am going to introduce Gavin Wiswell of Innovative Certified Care. They are a telehealth and remote patient monitoring company. So, Gavin, take it away.
Hi, everybody. And Deborah, thank you so much for having me on this webinar today. I just a little bit about me. I've been a licensed nursing home administrator for over 10 years and have really focused the majority of the time on how do we keep people safely out of the hospital and even out of the skilled nursing facility and let them age in place. And with the pandemic, there's been a major focus on transitioning to telehealth, social distancing, and really being able to provide technology to be able to support the great training that you'll hear today. We do specialize in remote patient monitoring, which takes physiologic data or vital signs and allows us daily to compile that information, interpret it, and then share it with the doctors so that they can make good decisions remotely on how to provide great care for your residents. I am a licensed administrator for RCFE as well, so I know kind of both sides of the house, the Medicare side as well as the private pay side, and really appreciate each level of care specifically for the attention to detail that they provide. What I've learned over the last several months is that remote patient monitoring can provide that tether to the physician or the care provider so that they know exactly what's going on with their patient. And again, it's to be able to support everything that you'll be hearing from the doctor and Rodney and Misty today. And so it's really just a pleasure to be a part of this call. Our website is icc-health.com if you'd like further information. But truly, I think that like Deborah had said, the learning from COVID-19 is that we can really take care of our patients and our residents in safer ways and keep them out of the hospital and allow those that are really sick to stay there. So with that, we'll go ahead and I'll let everything start, but appreciate the time and look forward to being a part of the call. Thank you.
Thank you, Gavin. So by means of housekeeping, at the bottom of your screen, you will see the availability of a chat window. We will answer any chat questions that you have before the seminar is over. We'll relay those to the main participants. And so if you do have a question, go ahead and send over a chat and we'll make sure that it gets communicated to Dr. Flowers and his team. One last thing, we are lookingforcare.com. We are your placement partner. If you'd like to know more about us, lookingforcare.com. That's enough of the sponsorship talk. Without further ado, I'm going to turn it over to Dr. Flowers.
Thanks so much, Deborah. Welcome, everybody. We're really excited about the opportunity to kind of meet with you today and to kind of share some information that we're hopefully going to help you continue to be successful in caring for COVID patients. I want to first thank Deborah and the Looking for Care team who's helped connect us today and connect us with you, and appreciate the support with Marianne and Kathy this morning as we have a few minutes with you, a little bit of time with you. The foundation today is foundational that we can help to kind of increase your understanding and kind of some ABCs of COVID care. Many of you are maybe already doing these things, so our goal today is for those who are to help validate what you're doing. Some others might need some reinforcement for what they're doing, so we want to provide that as well. And then maybe some new things that you haven't heard about that we wanted to make sure we introduce you. Myself, I'm a family medicine physician. I've been practicing in Riverside County since 1987. When I moved to Riverside County to my practice to work with Kaiser Permanente, I was with them for 33 years, and the last 6 years was serving as medical director until I retired in December of this past year of 2019. In those years being a family physician, many family patients or patients of mine who often were residents of residential settings, and some that in my time with those patients and understanding what great work you do and how you really, and many of you are like family to these patients and appreciate all the work you're doing. My latest visit to a residential care facility for the elderly was actually in January before COVID started, and one of my patients was on hospice, and she was in a 6-bed facility here in Riverside, and her daughter let me know, and I went by to see her, and I saw what wonderful care she was being provided. So not only from a physician as a son point of view and a nephew point of view of appreciating the great work that you do for family members who've also received care in facilities like many of yours. I got invited in mid-March to help with the team, and part of that work, and that's how I first met Misty, because she was part of the EOC, and we were working to help support our skilled nursing facilities at that point, kind of early in the COVID care. And the first positive patient in the skilled nursing facility was kind of my entree to coming with this team. And as things progressed, we were working with skilled nursing facilities, et cetera. And then what happened on April 8th was when we unfortunately had a facility a skilled nursing facility in Riverside County that needed to be evacuated because of some challenges with staffing support. And out of that day on the 8th of April, we actually had a reconvening of how can we actually increase our support from a county point of view to our skilled nursing facilities, and also not just our larger facilities, but also our residential facilities such as you with our 6 and 7 bed or less, and how can we provide improved support. And that's where it came out of the S plus OS teams. And basically the S plus means skilled facilities plus, our residential facilities and our RCFEs, et cetera, which include all of you. So many different layers of how can we help support. We're not a licensing agency. We're not regulatory. We're a group of folks who want to make sure that we are helping to support our folks who are taking care of our patients in our county. And that's where I met Rod, because then we came together. And after that, I think it was April the 10th when we first met and got a group together to start the work. And much of that what you're going to hear about today. Now, some of you maybe have already met Rod, because Rod's been doing a lot of visits across the county. He's been to facilities that are 100 plus beds, and he's been to facilities that have 6 and less beds. And Misty is the one who's been linking the appointments and the times in her groups with their groups. So if we've had a visit, we're glad to have you back here today. If we haven't had a visit, we'll leave that open, but we wanted to visit you virtually today to at least get the conversation started on that regard. So COVID's no secret to any of us. I dream COVID every night. It seems that about something that's happened during the day. But our goal is to, again, the world's changed, and how can we evolve with the change that's going on. So I'll get you to hit the next slide, please, for Mary Ann. So this was a quote that we were given, but basically can't say how, we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. And some of the things that you probably heard recently about us changing courses in the state has been about social distancing and about wearing facial coverings and those type of things that we've increased our education. Today is just kind of layer onto that. The next slide, please, Marianne. So you've all probably somewhat aware of the symptoms of COVID, but we just kind of wanted to remind you, and these have somewhat evolved. As most of you know, the loss of taste and smell now is kind of an earmark and often a first line. I was with a group of nurses last week who 6 had been recovering from COVID, and everyone said that they had lost their taste of smell and loss of taste and smell as they were starting with their first signs of infection. We know now there's even a symptom that's not listed on here about COVID toes. It's about a skin change on the toes of many COVID patients. And we're also learning that some things are post-COVID as well, i.e. you've heard about the childhood syndromes, the multi-system inflammation that's also we're learning about. So lots that we know, but we've learned in the last few weeks or a couple of months since this happened, but we're even learning more. We're learning more about how to treat patients in the hospital and the ICU differently than what was started in New York. We're not putting patients on ventilators as much for those who are the sickest, and actually some treatment plans. You've heard about remdesivir maybe, and you've also heard there's many trials out there, and of course all the work that's going on for the vaccines. So symptoms are listed here, and some are continue to evolve. Next slide, please. You know, how's it spread? We know it's spread by people, and it can be spread mainly from person to person through small droplets from the nose and mouth. When the infected person coughs or sneezes, these droplets can land in the mouth and nose of people, and that's why we're talking about our PPEs to help protect ourselves and keep others protected when we're wearing them. And it's more likely when people are close together. I was reading an article recently about, you probably heard about the choir, in that one person had it and affected so many. And so there was the conversation was about even singing, it might project the virus more. So just things that we're learning more about it. And the other next slide is going to spread, and we're going to be talking about all these things today, how to help support you in preventing it, is how does it spread through surfaces, because we also know not only from person to person, but also through via surfaces. So we're going to talk a little bit about that today. Next slide. So the point is, and I think is if it isn't an if about COVID, but it's when, because COVID's here, it's our reality. While we would really wish that we never had to deal with have an issue with your residents being infected or your family, your friends, there are folks out there being affected, and we see those numbers every day. And as we open up more, we hear this with the government, different states open up more, the likelihood of an exposure will probably increase again. So again, the point today is you might not have anybody in your facility, you might not have been tested, but how do we help support you when the COVID discussion or becomes a reality for some of us. So I'm going to go. So part of that risk reduction is personal protection equipment, and the expert right here who's been going out and helping to lend support to all the our facilities is Rod, and I'm going to turn it over to him and let him kind of give us some updates on this too, please.
Thanks, Dr. Flowers. Thanks everybody for being here today. So my name is Rodney Koenig. I'm a physician assistant. I've been practicing in the Riverside and San Bernardino area for the last 22 years in emergency medicine. Prior to that, I was a paramedic here in Riverside while I was doing undergrad at UCI. So those of you I've already had an opportunity to meet, thank you for inviting us into your facilities and homes. You're doing a great job. So I'm going to talk a little bit about the personal protective equipment, also known as PPE, that which we've been delivering out to your facilities and talking to both some of the administrators as well as the caregivers on how to use this. Next slide, please. All right, so 4 pieces we'll talk about in detail in just a moment are your gloves, the masks, gowns, and eye protection. Next slide. So the gloves, we need to wear the gloves with each patient contact, and you wear a new pair of gloves with each different patient. Change regularly. This is really important because this will decrease the spread. Any type of soiling on the glove, you need a new set of gloves. I have a technique where I use 2 gloves, and I will show that at the facility when I'm out, and the reasons for it, especially during cohorting. It helps you to become more efficient, and it also decreases contamination to yourself, which could cause a spread. Next slide, please. All right, so masks. So staff must be wearing masks or should be wearing masks in the building or in your facility. As with your residents, of course, the biggest threat to your residents, most of them are not leaving the facility, is those coming in. So we want to protect them from somebody coming in, sneezing or coughing. The mask should be changed if it's dirty. Now, the mask I'm going to start talking about is the N95 mask. This is the mask that is able to filter out the virus itself. So they tend to be in short supply. So the mask can be reused. I want you to remember that when you look at the mask, if it's dirty, soiled, starts to smell from the inside, or the straps, these break. I tend to find these break before the others occur, but if you notice any of that, that mask should be thrown away and a new mask should be used. If you're able to reuse the mask, and or if you have to reuse the mask because of supply, please use a paper bag. The plastic or Tupperware causes condensation, which will wreck the filtration system. So that'd be the reason to use the paper bag. Put your name on it. These masks should not be shared. This is your mask, so put it in your bag for reuse. There's also the surgical mask. The surgical mask, or a simple mask, is the one you can see on the picture here. That's a great mask to use if you have no positive patients and or no PUIs, persons of interest or under investigation. That's somebody who may have signs and symptoms and you're waiting to test, so they would be quarantined as would a COVID positive patient. This mask is appropriate to wear. What it does is decreases the chance of contracting the virus because you're not able to touch your nose and mouth this way. So many of us are not used to not rubbing our nose or mouth, therefore it's a good reminder. So if you reach up and touch that mask, ideally it's going to stop the small particles through the droplets entering your nose and mouth. We also use this mask to cover the N95. The reason is not for filtration purposes, but to keep the N95 clean. It will allow you to use the N95 longer. So if you accidentally touched a surface and reached up and touched your mask, you'd be touching the surgical mask or simple mask rather than contaminating the N95. We do not recommend touching the outside of either mask, as you may have some viral load that's collected. Therefore, you want to just touch the straps. Okay, next slide, please. Gowns. So the gowns are in short supply. You have multiple options. This is an example of a surgical gown. You would have seen some yellow gowns potentially is what you're using at your facility. Also, you could use cloth gowns that are washable. In desperate times, there's the opportunity to use rain gear and or the parkas. The idea of the gown or the reason for the gown is to keep the virus off of your clothing. So we want to decrease spread. If it's on your clothing, the potential to touch your clothing and touch another object is another way of spreading this. So the gowns are a way to keep our clothing protected so we're not carrying the virus outside. One of the rules I use both in the emergency department as well as in the operating room is when I'm in a COVID patient's room, or which would be the reason to wear this gown, or a PUI room, my hands do not go above my shoulders and it does not go below my waist. So I control my potential contamination area for my midsection. Avoiding my hands above my head stop me from touching my eyes, my nose, and my mouth, and or my mask or face shield. Sometimes the gown may need to be reused. That would be in a situation where you're out of gowns, or I'm sorry, going to run out of gowns. There's a couple different ways to remove the gown, which we're happy to show you if you ask us or invite us out to your facility. Some of you have had me out already. You've seen this. The idea is to decrease contamination to your skin, not because you're going to absorb the virus, but we don't want you touching the virus to your skin, then touching your skin and touching another part of your body and or another surface. So we want to reduce the risk of contamination. However, you cannot reduce it to a zero risk. There is the chance you will touch something when removing the gown. So what do? We wash our hands. And we'll talk about that further. When in doubt, wash your hands. When you're finished removing any type of PPE, wash your hands. Before putting any PPE on, wash your hands. You can kind of see the trend here. All right, next, please. Eye protection. So this may come in 2 pieces with a PPE. One is the goggles, which you can see here, or a face shield, depending on what you have access to. Both work very effectively. The reason is that we don't want you rubbing your eyes. The mucous membrane, you can contract the virus by touching your eyes with the virus. Therefore, this is a good reminder. Plus, if somebody were to sneeze or cough, it will reduce the risk of this going into your eye. So please wear the face shield or goggles. These are reusable PPE. Clean them, utilizing your Lysol wipes, your Clorox wipes, whatever disinfectant wipe you have, you can clean them, let them air dry. This is multi-use for multiple people. Now, when we're out at the facilities, remind them to clean them, and you have some trust. However, I still recommend when you go to put them on, you wipe them down yourselves, just in case, and to be extra cautious with this. Also, please put them on with clean gloves or clean hands, as you do not want to touch, you don't want to create a viral load on the glasses and you touch them again later. Okay, next please. All right, so other additional PPE information is obviously, well, maybe not so obvious, don't eat with your PPE on. If you're wearing PPE, is for a reason, is to protect you and your clients from contracting the virus and or spreading the virus. You don't want your hands up around your nose, your mouth, or your eyes, therefore you should not be eating with it on. Go to an area that's been designated for eating it, which is free of PPE, and ideally free of the virus because everything is wiped down in there. You may dispose of the PPE equipment into a regular trash, as there should be no blood-borne pathogens on this. Again, a reminder with the gown, if you do have it soiled, stool, feces, or any type, you should throw it away and not reuse it. Do not wear the full PPE outside. Mistakes that are made initially when the virus is coming out is that people were going out because, oh, I just need to pick this up. If you're in a small facility and you need to go to the next room, remember, wearing the PPE outside, you're going to contaminate the doorknob, you're going to contaminate the door jambs, potentially whatever else you're reaching, maybe not by your hands, but rubbing up against something. Therefore, leave the PPE in the room. Next slide, please. All right, donning and doffing. That's putting on and taking off. So the sequence of putting on, assuming this is clean, we're going from a clean perspective where this has not been used with anybody. So you would be outside of the quarantined area or corridor. So you're going to put the gown on, then your mask, your goggles, and your gloves. You really can't mess this up as everything is clean at this point. So, but this is a good pattern so that we have 1, 2, 3, 4, and how to put this on. Next slide. All right, gown needs to fully cover your neck, your knees as well as it can. You want to tie it appropriately. If there's a chance you're going to reuse a gown, use a bow so that you can untie it easily. When you're tying this, it's okay to have somebody help you as long as you're outside of the quarantined area. Next. Mask. So this is a surgical mask that's tied from the top and the bottom. Most of the masks you have are use elastic, and so it's much easier. But remember, when you're putting it on, the elastic could be contaminated. So you want to make sure you have clean gloves, your hands are clean before stretching this over your head. And the same when you take it off, the same idea as your hands and or gloves should be clean before you reach up so that you're not contaminating your scalp, in my case, or your hair in others' cases. Next slide. So goggles and face shield. So same thing, they're elastic. You please have clean hands and or new gloves when putting this on or taking it off so that you're not spreading contamination. Make sure it fits well because once it's on and you're in the room, you should not have to reach up and adjust this. Make sure you've had it on short for a period of time if you wear glasses to make sure it's not going to fog because what you don't want to have happen that it fogs while you're in there. Okay, there we go, gloves. So gloves, you want to look at the when you're putting the gloves on. This is not difficult because they're clean. You don't reuse gloves, but taking them off, you want to try to avoid touching your skin. And in doing so, you can see one of the techniques here of reaching from the outside and you're going to pull it over. Actually, when you're putting this on, you want to cover the wristband of the gown so you're not exposing your skin. Again, if you do, it's okay. You're just going to clean the area. And when you're all finished with this, you're going to soap and water if possible. If not, you'll use a hand sanitizer. Next slide. All right, for taking it off, the recommended CDC and in the handbook, which will be emailed, and we'll talk about that later, gloves, then goggles, gown, and mask. So there's two theories of this. One is you're throwing it away. This works. If you are going to reuse, then there's a couple different techniques, but no matter what, each technique you need to make sure you wash your hands and think, did I touch something? Did I contaminate myself? Should I wash my hands before I go to the next step? There is no rush. There is no emergency when taking this equipment off. So take your time and think through it. Next slide. All right, gloves. Here's an example of taking the glove off. As you can see, they're pinching the outside of the glove with a dirty glove and pulling it off. The second glove is removed by slipping the finger underneath the glove on the clean surface and then pulling it over. After this technique, wash your hands, because there is a chance you had some viral load on your fingers when doing this if the glove slipped. So again, in the room itself, you should have hand sanitizer. Next slide. So the goggles they recommend taking off next. Again, clean hands, of course, and or gloves. When I use 2 sets of gloves, I will treat my first set that's on my skin as skin. So you'll see me hand sanitizing my gloves if I have those on, because they haven't touched anybody, so I treat them as my skin. But if you just have no gloves on at this point, make sure you wash them, then reach to the back, and you're going to pull the elastic off and forward, not touching the outside or front of the mask, the face shield or goggles, as that may have virus on it. Next slide. The gown. So when reaching back behind to untie or off to the side, again, you want to have clean hands. You do not want to contaminate this area as you're touching it. And you're going to slip it forward, as you can see they're doing here, to where it's slipping over your hands. And then you can see they're rolling it up. This is a gown you're throwing away. There's a little bit different technique as you slip your hands, clean hands out of it, and then you would hang it up in the room. Again, my recommendation is if you have a positive patient or a PUI, and you're unsure or uncomfortable using the gown because you're not sure how to take it off and put it back on again after it's been used, please reach out. You'll reach out to Missy through our MOAC, and we can schedule some time to come out if I haven't showed you already. What I really want, and what we want as an organization in Riverside County, is both you and your caregivers to be comfortable. Not to be fearful, but to be comfortable and confident when doing this. It's less mistakes, and if you do make a mistake, we show you how to cover for that, which is washing your hands. So when you're comfortable and you're confident, your workforce is great at work. They understand how to manage and mitigate the risks. Next slide. Mask or respirator. So this is when you're taking the mask off. Again, clean hands, reaching back. And in most of our cases, you're having elastic. You're going to pull the elastic forward, not touching the inside of the mask. If it's an N95 mask that you're going to reuse, put it in a paper bag that's labeled with your name, and you can reuse it again. When reaching into the mask, you want to reach in and grab the elastic, obviously with clean hands. When you're putting the mask on, if you have to adjust the bridge of the nose again, it's recommended you wash your hands right after touching that. A note with the elastic, this should reach under your chin, meaning the mask is under your chin. The bottom elastic band should come up higher over the head, so it's causing a seal to the bottom. And then usually the top one goes straight back, maybe a little high, and you'll feel the difference in the way the mask fits. Next slide. Washing your hands, so you want to use alcohol-based hand sanitizer immediately after removing all PPE, as I said multiple times. Next slide. All right. This is an email. We'd like you to reach out to us through this email here, so you can receive a copy of the book I'd referred to, which is a COVID-19 Care and Safety Handbook, also referred to as our Riverside County Playbook. What I'm talking about today and everything we've talked about in risk is in that book. It's extremely helpful with contact information. There's video links on how to don and doff the PPE. There's also information in there for mental wellness. Because of the stress of this virus, it's something new. None of us have experienced before. So we want to make sure that your caregivers are well taken care of. They start to have stress. They start to be concerned. There's somebody to talk to 24 hours, and that's in the handbook as well. Next slide. All right, so again, we'll go over hand washing. Washing your hands, always wash immediately. Use a hand sanitizer, should be at least 60% alcohol. At the end of taking care of somebody, when you leave the room, I recommend you wash with soap and water from the elbows down. This is because if you're reaching back, taking off things, you may have contaminated the forearms. So soap and water afterwards. Do not touch your face. Make sure you've done this after you've taken care of a patient. When in doubt, if you think to yourself, did I touch something? That's acute, wash your hands. I might have touched something, wash your hands. You can't be too safe in this case. Next slide. So before and after all residents, before putting on PPE, anytime you're about to do something that is for yourself or for one of your residents, wash your hands. Coughing, sneezing, of course, the recommended is into the elbow. Wash your hands, wash your forearms in that case. Just think about the potential of spread, what could be contaminated, and clean the area. Next slide. Make sure the soap and water, of course, in soap and water available, but also the hand sanitizer available of each of the rooms. You do not know what is going on in the room before you go in with your residents. It's a good idea when you walk into the room, wash your hands. Why? We don't know, you don't know who touched the doorknob, who touched the door jamb. So wiping that down regularly throughout the day is a good idea. Going in and out of the room. We use this in and out technique in the emergency departments. If you go into a patient room, out of a room, whenever you're with, you wash your hands. Next slide. Staff should always use proper hand washing hygiene with soap and water. It's at least 20 minutes scrubbing the tops, bottoms, the fingernails, above the wrists with hot water. Next slide. Here's some techniques which are in the handbook. Next slide. Other techniques, remember we want to get between the fingers, the creases, the fingernails. We want them to vigorously wipe the area. When they spend the time cleaning, and I haven't found facilities or anybody I've spoken to that isn't utilizing the 20 seconds. They're concerned, right? They're concerned with themselves, and they're mostly concerned with what we're finding. They don't want to bring the virus home. So this is a great way for them to reduce the risk of bringing the virus home, but also we talk to them about educating their families, where the real risk is. Part of the risk is at the facility if you have a positive patient or a PUI. A lot of the facilities haven't tested. They feel that they're safe, but I remind them if you haven't tested, you don't know. Although there's no signs and symptoms, that's great. But at home, the risk is really in the community. So teaching your family how to wash their hands and understanding the risk at Costco, the grocery store, we have to think about those risks. And what are you doing to mitigate risk from coming to your home where you might contract it and then bring it to the facility? So educating your staff about where their threat really is extremely important. And we're happy to do it as well if you have us out there. Sometimes hearing it from two different voices and two different approaches, it sinks in. And I relate this to coaching. I've coached high school football. I can tell, which my sons were there, many times I would tell a player something, but then with my son, someone else says the same exact thing, it seems to sink in. So I don't care how they get the message as long as it's there. So we want to be there to support you both in what you're doing, and by repeating it, they get a lot of validity at that point in both their administrators and their leadership because, oh, they're saying it to them as well. So they get the confidence in you. Next slide. All right, and other techniques, or the same technique, is just showing you more thorough hand washing. And it's in the handbook again. And wiping things down, right? When we're all done, when you reach out to touch the surface, you want to use the cloth you're drying your hands with, right? Because you just potential for viral load that may be sitting on the handle that was used before you or after you. Next slide. All right, cleaning, Dr. Flowers.
Yeah, thanks so much, Rod. Great job on kind of explaining ways to help protect folks. So next is about cleaning. We talked earlier about it's person to person, but also from services. Next slide, please. So Rod mentioned about all the things that potential could be touched, there's tables, doorknobs, light switches, everything. So it's so important to kind of frequently wipe these things down with cleansings. And the next slide actually talks a little about, we know that there's commercial products out there, many of you use it, but there's somewhat of a shortage, and we've heard folks talk about that, that they can't get the bleach wipes, etc. So here's some actually a formula a little bit that you can use to delete the bleach, a 1/3 cup of bleach per gallon. And many of you might be already doing this, but 4 teaspoons to 1/4 water, but how it helps support cleaning and killing germs on the surfaces. And also, again, wearing gloves to make sure that you have good ventilation in the areas when you're using the bleach is important. And many of you might be doing this, but just a little helpful hint, a reminder. Next slide, please. This actually gives you a list of EPA registered disinfectants on this website. And again, that is something that you can, if you don't already have access to, that you can go and list and find out other things besides making your own, what else might be out there. Next slide, please. And of course, I'm sure you maybe already have protocols, but how, and you're the experts on making sure before COVID, it was either a neurovirus or C. diff, of how you're making sure you decrease the likelihood of contamination and passing these viruses and bacteria on. So just making sure that staff's got cleaning responsibilities. I think in COVID, it's kind of everybody's responsibility to make sure that we're doing these things, but understand the timing of what needs to be cleaned and disinfection products, knowing what the guidelines are as far as how long it needs to be there and before you could go touch it again. And also ensure the shared and non-dedicated equipment is clean too. Sometimes that's the ones that you're not initially thinking about, but just making sure everything's re-clean. You can't be too safe and clean enough in these situations. And then also, should you have a resident that maybe transfers out, or certainly someone who passes, that you do a deep, thorough cleaning after a resident leaves that room, and before someone else comes there. And also making sure that staff don't come in until that room's been cleaned in a safe way before people come back in there. Next slide as well. And then this is just about, other than surfaces like your carpet and your rugs and your drapes, your soft surfaces, they're important to clean as well, not just the trays and the bed rails and the doorknobs, but also the other aspects of cleaning, and your laundry items, according to the manufacturer instructions, and also suggest you're using the warmest appropriate water setting, and make sure you dry the items thoroughly before use. Next slide, please. So another talent that Rod has had and shown is actually when he's gone to the facilities to help folks on cohorting and how to help arrange them. So he's been into many of the facilities and seen the actual physical structure. So we're going to let him kind of talk about this a little bit here.
So thank you. What I'd like to talk about with the caregivers right away is to find out what their fear is. Because I want to make sure fear of covering or taking care of a COVID positive patient or PUI, what that is, so we can help dispel some of that. Because what we want is a caregiver to be confident, calm, and not afraid of what they're doing. They'll make less mistakes that way. And the mistakes are contaminating themselves, contaminate other residents, and bring it home to their family. So understanding the spread of the virus, how it occurs, the importance of the PPE, utilizing it right is really important, so that when they're in the room, they understand what the real threat is or where the real threat is. So when you have a positive patient at a facility that has private rooms in the microsites, they're able to ideally quarantine or isolate the person in that one room, so that when we're managing the person, we're trying to keep the virus in that room. We're trying to keep the viral load down by cleaning the air regularly, making sure you're leaving the PPE in the room, taking it off, putting it in the trash, or hanging up to reuse it again. We like to utilize one provider in the room only if at all possible, both at smaller facilities and larger facilities. It decreases the footprint coming in and out, decreases the risk of spread as well. If you find that you have multiple positive patients or multiple PUIs, identifying an area to where you can cohort, have multiple like patients. You wouldn't want to mix a PUI with a positive patient, but having a room that you can have multiple PUI reduces your rate of PPE burn. You can utilize the same equipment, except for the gloves, of course, with those like patients. What that does is it allows one person to manage multiple people and reduce the risk of spread by contaminating multiple people. And when they come out of the room, it's the one person that is going to clean everything. They understand what they used and the supply that they're going to need to go back into the room throughout the day. Facilities that have the ability to cordon off a wing or an area, a hall, these are facilities that you can contract or expand the amount of rooms you need based on the resources you have and how many positive PUIs. So going out to the different facilities, we've been able to sit with them. There's no one way to do this, other than isolation is isolation, and the type of person you isolate is the type of person you isolate, positive or PUI. But helping them understand an area that works well for quarantine, that you can expand and contract based on your needs. It also gives a visual cue to the caregivers, so they understand, in this area, this is the PPE I need to be wearing. No exception. Out of this area, it doesn't mean I'm safe. What it means is that we're controlling the virus as much as possible, but out of the area, I don't have to have the N95, I don't have to have the gown on, but I still need to use the PPE precautions and washing my hands, proper hygiene, and understanding wiping surfaces. So that's another clue that keeps the staff calm, keeps them confident, and the sense of being safe because they have control. Next slide. All right, laundry. So we want to make sure that we're laundering appropriately and that we have separate hampers, so the positive patient's clothing stays in their room until it's going to be laundered. We're wiping down the hampers regularly. We're utilizing PPE equipment when touching the laundry, because the risk is the virus is on their clothing. there is a risk of it being on the caregiver's clothing as well. So we want to make sure the caregiver, if at all possible, has a change of clothes before they go home so that their clothes are laundered immediately from work. They change in the garage if they weren't able to change at work. So it's reducing the amount of spread, protecting their family and their loved ones as well. Also, if they're working at multiple sites, they should have a fresh set of clothing before they go to the next site so that they're not taking potential contaminated clothing articles into another facility. What I have heard visiting all these sites is that, oh, we're going to sites that don't have positive patients. Again, the question comes, has everybody been tested at that facility? And when were they tested? Because if they were exposed after their testing, the potential for the virus to be there is there. And the potential for a patient to not have signs and symptoms, but yet be carriers and potentially spreading the virus is still there. So we want them to think regularly, how could I get the virus? How could I spread the virus? Don't take the dirty laundry outside of the washing area. You want to make sure it goes directly into the washing machine if possible. If you don't have a washing machine and you need to go to a laundromat, you want to secure the clothing. Don't waft it, which is meaning don't shake it out. You don't want to aerosolize the virus. Dry items thoroughly. Clean and disinfect, again, the hamper and the area that the clothing may have touched. Next slide. All right, meals for COVID-19 residents. So as we're feeding our residents, we want to understand, again, the droplet transmission. So after the client has eaten, the potential for the virus, if it's a positive patient PUI, is on the utensils as well as the dishes and so forth. So you want to make sure you're utilizing the proper PPE when managing their food and afterwards their dishware. If you can use disposable, that would be best. That way you're not risking washing it. If you can't, it should be immediately washed, put in an area where the contamination is going to be low and others aren't going to touch it. Washing your hands before and after managing it. If you have a larger facility, you want to have one person going into the room. So ideally the caregiver is bringing and feeding the person. If possible, that the positive patient or PUI can meet you at the door, take it themselves into the room. You're reducing going in and out of the room, reducing contamination as well. Again, wearing gloves when handling the dirty dishes and silverware is really important because, again, the virus is on droplet formation and it's going to be on the silverware. Next slide. Dr. Flowers.
Thanks again, Rod. So we all know that antibiotics don't work against viruses, and certainly the coronavirus. There are some antivirals out there to help decrease the potential of some of the corona COVID damage. So this is just to reinforce for folks who might ask you that question, families, and certainly some of your residents. Next slide, please. You know, our employees and our staff are so important, and it's important for them not only to be safe at work, but also safe at home. And, you know, we're concerned about our residents, and we're concerned about our folks. So all of these messages that we continue to go over, and repetition is so important, especially as our counties start opening up more and our staff and employees and their families are potentially going out more in the public that could maybe expose them. Next slide, please. So, you know, Rod mentioned this, but we really want to underscore the importance of this because we do know sometimes staff work at a second location. And if that's the case with some of your folks, it's most important that you're communicating with them about should you be the second location or the first location that the staff has a change of clothes, and that should be bagged and taken home to be laundered. Hopefully everyone's gotten the message, but the foundation of decreasing spread is good hand washing, but hand washing multiple times in a day. Again, studies have shown with other infections, whether it be SARS or C. diff or any other type of virus that can be spread this way, multiple times washing your hands decreases your risk of getting these viruses. And also, a mask should not be worn at a second location. It should be worn at the original location. And as Rod had mentioned also, there's often, if you're using the N95s as one of the sources of the type of mask, but also surgical mask, is having them identified for that specific location. Next slide, please. In our discussion with our staff, and matter of fact, when the SOS's teams have gone out and asked staff, and you ask them, how are they doing? They say, well, we're okay. But when you ask them about their families, than that, you get much more movement and animation in the audience, and that's because we are most concerned about what we're at work, but we don't want to take anything home, and vice versa, don't want to bring anything home from work. So it is important, and Rod mentioned this, I want to reinforce it. Clothes should be changed as they enter the home, whether it be in a garage or be in a special place, put in a hamper and washed as soon as they get there. And folks should not go from work to the grocery store and their clothes are out shopping. They should change before they go out, because you're decreasing the risk of anything that's on your scrubs or other clothes that you're wearing being passed on to other areas. Leave your shoes at the door, and also change your clothes, go immediately to the shower and bath, and encourage our staff and employees to do that. Next, please. Should there be an exposure at the workplace? Another staff member has gone out and unfortunately was in an event and exposed to a family member, or they went, now that things are opening up, they went to a place of worship and they were maybe found out someone was exposed there. So it's important to limit your interaction with family members. We talk about the distancing being so important. We hear this over and over again, but staying that distance apart. And also you'd want to stay in a separate bedroom and use a separate bathroom at all possible as you're waiting out and taking your temp twice a day, and you're monitoring your symptoms for 14 days of any potential exposure to decrease understanding should you have been exposed, and also should you been infected with the virus. And also good cleaning, which we've hopefully underscored today, potentially infected areas or areas that have been touched by the virus. Next slide, please. Self-monitoring symptoms, and hopefully at each of your facilities you're already doing such, but have a process where you're taking your temperature at start of shift and make sure no one has a fever as they're coming into work, and self-monitoring symptoms several times a day. One coming work and second one about 12 hours later. I know I personally keep my thermometer at bedside, take it when I wake up in the morning, when I get home from work, and before I go to bed. So it's just kind of my habit I've gotten into since COVID has kind of started there. And if any of the symptoms that employees have, they should call the facilities and be off work if they got the symptoms. Now, that being folks that work in your facilities, and we're all considered, medical personnel considered essential employees. So if we were exposed and we're not having any symptoms and wear a mask, is what CDC has suggested, and certainly the Department of Public Health in Riverside County is that you're allowed to do as far as employees and being essential workers. Next slide, please. We talked about symptoms earlier on, but these are the things that folks should certainly have in their head of things to watch for. Is you as residential facilities would all be important for us to all to know these different symptoms. Next slide, please. Training. We appreciate the opportunity today to be able to do this training and education, and I'm sure you're probably doing others there, but just making sure you're keeping documentation for your staff. That this will be important for folks who might inquire what people are learning and trying to be safe in taking care of your residents. And family members will probably want to know that as well. So, this is a good example of pre-COVID where people weren't social distancing or wearing masks in this photo, but we're much different than that now with our social distancing and our facial coverings as well as our virtual care. Next slide, please. Staff roster, you probably all have everybody on speed dial, but this was an added slide just to make sure you've got folks and understand, because I don't know if you've experienced this or not, but some of the other long-term facilities have had an increased number of call-offs, so having backup plans, and many times those are larger facilities than your microsites, but I'm sure you have a dedicated list of all your folks there. Next slide, please. Outside vendors. Outside vendors, these are folks who are always wanting to be knocking on our doors and making sure that we can come in, but please don't let them in the facility. And hopefully, I think everybody understands that at this point. However, and have somebody meet them at the door to receive certain items. Now, that being the case, sometimes you might need a contractor or vendor to come in and and maybe you've got a plumbing issue or air conditioning issue that you need someone physically to enter the building, but make sure you're screening them for symptoms of fever and making sure they're wearing their mask and their PPEs when they're coming to your facility, please. Next, please. Families and friends. This is probably the most difficult thing that any of us had to deal with this time of not being able to see their loved ones, and they're entrusting you with that care. And sometimes with compassionate care of end of life, family and friends, we have been allowed to come in, but making sure that you're screening them and also have them to wear PPEs when appropriate, especially in your facility for COVID prevention. And I'm sure you're having virtual meetings and FaceTime with folks to kind of help them connect with the families, but this is what we're suggesting for families and friends too, please. Next. And this is just to kind of reiterate the last statement about end of life and signs and virtual teleconferencing, et cetera, and limiting the duration should they come with significant situations. Next slide, please. Well, we've been talking about, certainly the folks that are infected, but we also know that about 80% of folks recover from the illness without needing special treatment. However, we also know from the studies is that our seniors and our elderly population are at higher risk for having a more serious complication from COVID. In Riverside County, we've been asked about our numbers. You probably heard from neighboring counties. I think LA has quoted a number of 52% of their deaths in LA County has been attributed to folks being in custodial or in facilities, congregate living facilities. Riverside County, we've been monitoring our numbers, and it's not that highest percentage. We're actually under 30% in Riverside County. Any percentage is too high, but we do know that there are a lot of folks who are recovering without the disease, and unfortunately, that's part of our problem because sometimes folks don't have significant illness and they don't know they have COVID and potential spreaders. But it's most important for our seniors to kind of give them that extra effort and TLC to oversee and make sure they're safe. Next slide, please. We mentioned about the playbook, and Rod kind of mentioned, but it's so important that you email us and we get you a soft copy of this information, plus what we talked about today and even some more as far as resources. Again, it's to help reinforce the information we got today. We know you get tons of information and lots of links and all these things. So this is to kind of drill it down and have it in a little more digestible form that we'd like for you to be able to have at your fingertips. Next slide, please. And in the resource, in the book or the guidebook, there's a lot of resource references. As a matter of fact, the first one on here is about the medical and health operation area, MOOC, about how to order and document things. And there's also one, I think, and there's some video references, CDC checklist, and frequently asked questions as far as putting in those. And next slide, I think, also gives a phone number of how to reach. And we talked about coming out there, and Rod and the team and Misty, I'll ask Misty to speak in a minute to kind of talk about, she is the one that links the facilities and the appointments. So this is a phone number that if you haven't had a visit and you'd like someone to come out and eyeball, to educate and also eyeball your facility and see if there's any suggestion on cohorting, et cetera, please call. And then also the SOS web email site to put down there, and then public health and some other important phone numbers that we want you to have. Misty, you're on the line. If you're still on the line, anything else that you'd like to let our folks know about our microsite teams as far as the work that you're doing to link up and what we've talked about today?
Thank you, Dr. Flowers and Rodney and our team on the call. I much appreciate the training here and the questions that I'm seeing in the chat. I did want to let you guys know that the state of California has a centralized point for resource ordering in crisis or disasters, and that is the medical health operational area, or MOOC. That's that top phone number that's on the slide you see on your screen. That is a centralized point where a facility could call and get help with resource ordering, things like masks and gloves. I'm sure you have some vendors for those already that you use, but I also know in a disaster situation we're dealing with the pandemic that's been impacted a great deal. We also are.
Hey, Misty.
Yes.
Misty, before you go on, there was a question, not so much about PPE, but just basic supplies like toilet paper and paper towels. Particularly our smaller operators are having to go to Costco and to the grocery store every single day because, of course, you can only buy one at a time. Would Mohawk be a good resource for additional toilet paper? And certainly Smart and Final and Costco are not a good source because the limit is one per customer.
Yeah, Deborah, the one challenge that we have is with paper products. We have ordered quite a bit of food or hand sanitizer, or we've tried to assist with Clorox wipes and Lysol, but we do not have access to a statewide or nationwide vendor for paper products. Unfortunately, we are bound by the same challenges as everyone else, but we're happy to try to source those things for you. I know that we don't have a ready supply of them waiting, though, unfortunately. But we have helped out with milk and bread and food because of similar limitations.
Right. Well, we'll keep an open dialogue, and if there is a solution that would preclude or help our operators not have to go to the store every single day, that would be great. So we'll just keep an open dialogue. So I'm sorry, Misty. It just seemed like
no. It's definitely a great time for that question. And I appreciate it. It has been a challenge for us as many of us realized the supply chain impact was pretty broad sweeping, from everything to regular soap to bleach to other things in a way that we hadn't really ever impacted before. So it was a challenge even for our resources at the state and federal levels to respond to reasonably. So the other piece I wanted to make sure that I emphasized is the email. That is the second piece on your screen there, the second item, that SOS team email. I know that in many cases with our residential facilities, we've reached out, and perhaps you may have been reluctant for a visit before or not in a place to have a visit, but Rodney and Dr. Flowers have mentioned the visits that we've hosted. We're happy to come out a second time or come out again, and we're accessible either via email or that phone number that's there. And we can also meet you in your courtyards, breezeways. We've done training in the garage of some of our facilities as well. We don't have to go physically into the facility at all. So thank you, Dr. Flowers and Rod, for your presentations today and for the opportunity to add there a little bit.
So, Misty, we really appreciate the work that you're doing and helping to get our folks on the calendar to have this relationship built even stronger with Rod and the team and the SOS teams. So we want to thank everyone, and I would ask you, Deborah, is there any other questions that we want to touch on?
Yes, there are. We've had, it's kind of a suggestion and a request to sort of open up dialogue. And it was from one of our participants. It had to do with, and maybe this is a good question for Rod, it had to do with the best protocol for removing gloves out of a room. So you remove your gloves, you throw them in the garbage can, particularly for our residents that have dementia. It was suggested by this participant that perhaps it'd be best to take that garbage out with you as opposed to just throwing the gloves into the trash can. Do you have any additional protocol, particularly maybe with dementia residents, that to pay attention to as with regards to gloves?
Sure. We're not suggesting you vary from any of your normal protocols, especially with the memory care patients. What I would recommend is taking the small trash can liner plastic bags, and I would utilize those. I would put the stuff that I'm throwing away into that, and I would remove that as well from the room immediately. So recommending everything with cleaning, having everything in the room is a non-memory care patient, but remove it utilizing the small plastic bags. They can go into a larger trash bag outside. The idea is we don't want anybody to utilize a trash can by reaching into it where there's potential viral load. So if you're in a safe area, or whether that's outside, immediately taking the trash to the outside trash bin and putting it in there would probably work really well. Again, don't leave anything in the memory care room that you normally wouldn't leave. When you remove it, just remember you're going to need to wipe it down. So if you did go in with a large heavy-duty plastic bag to bring your supplies with you to manage the patient, and when you're out, use the Clorox wipes to wipe down the bag afterwards, assuming maybe I sat it down on something that had the virus. That's really what you need to do, is just clean things when you come out of the room.
Then, along the same lines and from the same participant, there was the suggestion about managing laundry. So you mentioned that you don't want to fluff the laundry because that could aerosolize the virus. But this suggestion was, once you bring the laundry of a positive or a PUI patient, is to spray the top of the laundry with a disinfectant so the virus wouldn't spread in the area. Is that a good practice? And can you expand on that?
Sure. I think spraying it in the room would be fine. It's extra caution, but placing it in a hamper before leaving the room so that you're not dragging it across any of the furniture or hallways. So you want to secure whatever potentially has been exposed or contaminated as much as possible, and then taking it from the room directly to the wash area, starting the wash, closing it, and then wiping the hamper down. So controlling the spread is controlling the movement of any of your PPE and or linen. So I think if you're comfortable spraying it down and then putting it in, that's just an extra layer. But securing the linen is important in a small area without wafting it, and then laundering it as soon as possible so that others aren't exposed to it.
Got it. And from the same participant, there was one last suggestion that they wanted to open a dialogue about. For PPE that's going to be worn again, typically a gown or a mask that you're going to leave in that room, do you recommend spraying that? Is that, and is there a procedure for doing that?
So I would not leave the N95 in the room. I would not take my N95 off in a contaminated room. That comes off outside, and so it's in a paper bag with my name on it so no one else uses that. Yep. The gowns, it depends on the type of gown you're going to use. The surgical gowns are heavy duty. You could wipe them down with Clorox wipe or spray the gown if you felt that would be another layer. Some of the yellow gowns tend to be thinner and will break down. I don't know that there's protocol in terms of washing those. If you're going to use laundered gowns, I would take the gown out and I would put the gown in the laundry. If you're going to hang it up and use it again later, then again, it depends on the contamination. Now, point of clarification, if you are to soil the gown of any type, you take that out and it's disposed of. So if there's any products of contamination, stool, feces, urine, or the potential, if it's wet at all, that should come out and be thrown away. This is a gown that appears to have nothing on it. Therefore, you think the potential is that there's COVID virus on here from a droplet contamination. I'll hang it and reuse it. But we're not advocating reusing a gown that has been soiled in any other way.
Yeah, I think it was, go ahead.
I think the other thing I just want to mention is that there has been a shortage of gowns, and so folks are using other things creatively, like even a lab coat that's washed, or we talked about cloth gowns. I think those who've been to Disneyland when it rained, use these ponchos that, these dollar ponchos that different types. So people have been very creative in what they've been using for covering. Just wanted to mention that because I don't think we've mentioned that part as well.
Okay. All right. So for all the participants that have been on this webinar, we've recorded all three. We will edit it to the best presentation, and we'll make that link available so that your caregivers can also get this information. It does count as caregiver training. It's 1 hour of caregiver training, and we'll make it free and available to you all. If you're interested in the handbook, the playbook from Dr. Flowers' team, please send us an email and we'll send you the PDF. If you have any other questions, you've got our email addresses. We will be as responsive as we possibly can. Thank you again, Dr. Flowers, Rod. Thank you, Marianne, for the great job. Thank you for being on the call, Misty. And thank you, Gavin.
So thanks, everyone. Be safe. We know that it's a different time out there, and we don't, one of the most challenging things is feeling alone. We don't want anybody to feel alone in all this challenge, that we're here to help support you. And so we appreciate you coming in today and listening to our presentation. Thank you.